Welcome to the Provider's Report, where we delve into the world of value-based healthcare. Our mission is to empower healthcare providers with the knowledge and tools they need to deliver exceptional patient care. Each episode, we explore best practices, innovative strategies, and real-world examples of how to achieve the highest standards in patient communication and outcomes. Join us as we transform the future of healthcare, one conversation at a time.
Hey guys, we are going to be talking today about why every single one of you listening should be providing value-based healthcare. Some of us have heard of it. We know what patient-centered care means. We know what value-based care means, but we're going to talk about why. And I have David Payton here with me, and he's going to tell you guys a crazy story about meeting with a very, very top-of-the-line, humongous hospital system in Southern Africa with a very specific C-level operator of that company, and them literally declining anything to do with the value-based healthcare system. Why was this meeting so drastically wild? What happened in that room?
Well, first of all, we were commissioned by Spine Care Partners to establish a value-based spine pathway for implementation in approximately 50 hospitals throughout Southern Africa.
Huge.
So this was an enormous potential project. We had all stations go. We sat down with this individual and we finished our presentation, and he looked across at us and said, "No, we are not taking this project on board. My mandate is to put bums in beds."
Oh, that just breaks my heart.
Yeah. And that is classic fee-for-service healthcare. And that is essentially, in its bluntest form, represented in Southern Africa, but in other forms throughout the developed world as well. So there we are.
Absolutely. So let's dive into the difference between that fee-for-service model and value-based care model. What are some core differences there that are obvious?
Well, the fee-for-service model is easy to understand because it's so widespread. It's patient has a problem, visits a provider renders a service, whether it is value-based, evidence-based or not, and a fee is rendered for that service. So in terms of outcomes are lower down on the pile of priorities in that context. That's fee for service. Fee for value or value-based healthcare is a model that was specifically proposed by an individual by the name of Michael Porter, who proposed the model several years ago. He wrote a book in 2006, and the book's title is Redefining Healthcare, Creating Value-Based Competition on Results. And from that, he developed essentially an equation that metrically determines what value is. And the equation is patient value equals patient relevant outcomes divided by costs per patient to achieve those outcomes. And so when you plug in the variables into this equation, you can very easily see how value can be increased for patients. So patient value is defined as patient relevant outcomes divided by the costs per patient across the full cycle of care in order to achieve those outcomes.
I love that. So could you give our listeners an example of either a primary practice or specialty practice kind of setup, like an example of how they can assume that kind of value with that formula?
So probably a classic example that has become quite well established in orthopedic surgery is hip replacements. So the situation with a hip is interesting. It's a common orthopedic complaint and a situation that many patients find themselves in. It is a standardized problem in the sense that OA develops gradually over time. It has certain clinical signs and symptoms that are observable, testable, and repeatable according to the scientific method. And consequently, there is a standardized way of treating and handling that case. So if you use the calculation, you need certain outcomes. What are those outcomes? They are patient relevant, which means they need to fit within the patient's required outcome profile. They need to move. They need to be reduced. They need pain reduction. And you need to implement a solution. You need to implement a intervention that has a controlled cost attached to that. And when you do that, you achieve a certain patient value outcome. So with hip surgery, the more you standardize, the better the value.
Absolutely. And I honestly want to share a little bit about something that was shared with me as a student. When I was learning, when I worked at the VA hospital system, when I was working with people and they were trying to educate me on the difference between fee-for-service and value-based care, it came down to what we deserve as providers. Mm-hmm. So if you look at other fields and specialties, like let's say you work in IT, you deserve to probably get some more intense and bigger jobs and bigger salary and bigger whatever based on your abilities as an IT specialist, right? That would involve your abilities, what kinds of things you can do with your job, what solutions you bring to the table, how efficient you are at your job. So when we take that into consideration with healthcare, doesn't matter what specialty you are, physical therapist, hip surgeon, whatever. If you have 100 patients and I have 100 patients, most of mine get better, very few of yours get better. Shouldn't I be doing better in general, both financially, both in terms of how many patients come to me versus you, right? But that is the obvious value-based healthcare system. It doesn't matter that I did 100 surgeries and you did 100 surgeries. What really should matter is the patient outcome majority of both categories, both groups.
That's exactly right. And there should always be patient outcomes as prima in the context of value. You should never prioritize the service as a service.
There you go.
The service needs to prioritize the outcome. And not only the outcome, but it also needs to prioritize the provider experience as well. The provider must feel like they are developing systems and delivering value in a way that they are comfortable with and they're confident in, and that they're not just contributing to the financial bloat of a system.
And people are searching for that. You know, they want to find value in their career. They want to make sure that they're making a difference, you know, when they wake up every day and treat patients and not just following this algorithmic system. So to piggyback off that, could you talk a little bit about our current system with the fee-for-service model and some areas that we're lacking? You just mentioned one of them. Provider satisfaction is definitely a concern. What else are some negative points of our current setup that we need to potentially change?
Well, the obvious one is patient outcomes, which we've mentioned before as well, but patient satisfaction, and that can be, there's multiple layers to that. So patient satisfaction, not just with the outcomes, that's an obvious one, but it's a patient satisfaction with the experience of care itself, with the communication from the healthcare provider, with follow-up to the care, and even in the entire billing cycle as well. So patients are concerned about the costs to them, but they want to experience a streamlined, easy to understand billing experience across the entire continuum of care. Those factors are all part of value-based healthcare.
Yeah, so how would value-based healthcare, how would that shift toward this newer model and concept essentially flip all of that? What would be the result?
There'll be an emphasis, providers must emphasize patient outcomes, patient satisfaction, and patient-specific outcomes as well. As we've discussed in a previous episode, there must be an emphasis on unique, individualized patient care, such that a pregnant mom doesn't need to have surgery when she's pregnant, and maybe an elite D1 athlete needs to have immediate surgery because he or she needs to get back on the field. So there's that level of individualized, focused, personalized care. And that each and every one of you listening is able to do. You're able to adjust your course of care to not simply deliver evidence-based care, which is all right and good, what the research says, but it's evidence-based care that is specifically tailored to the individual needs of your patient that's in front of you.
Yeah, that's a great segue. You actually educated me on the quadruple aim in healthcare. Can you tell us a little bit more about that concept and how it relates to all of those facets that we should be regularly looking at as a provider?
Precisely. So, yeah, there was historically a triple aim in healthcare, which was 3 elements that were aimed at, which is improving patient outcomes, improving patient experience, and lowering the cost of care. And as time has developed with the Institute of Healthcare, the IHI, they developed a 4th branch to this, which is the improved provider experience. So those 4 elements encompass the quadruple aim of healthcare. And if we can balance all of those, it's a win-win-win for the patient, for the provider, and for the system. So the system is currently winning, where services are being rendered and fees are being paid, and the system's getting wealthier and wealthier, and folks are suffering. But where you get a win-win-win, everyone's happy. Everyone wins, and patients are getting better.
And I think a good concept to talk about at the end of this episode would be especially the provider, the individual human being that is delivering these services. To a lot of our listeners, we already know that in healthcare we're suffering a huge physician shortage right now. We're suffering things like physician burnout. Yeah. We're just in this unique period where it's no longer this high and mighty sunshine and rainbows concept of getting into healthcare. You have to really love working with people in order to love your job as a healthcare provider. You know, I belong to so many Facebook groups and I've read so many books, and there are incredible physicians who don't want their kids to become physicians. They don't want their kids in healthcare at all, and that breaks my heart. But a lot of that has to do with the fee-for-service model and how it is not setting us up with great work-life balance. It's not setting us up for leading these fulfilled jobs and fulfilled lifestyles. And I really think value-based healthcare is the answer. I know that the World Health Organization is really trying to push for that shift. And it really is the future. As you mentioned, win-win-win. Providers are going to benefit, patients are going to benefit, and organizations and systems are going to benefit as well.
Absolutely. You know, a case in point on that is reimbursement models. So if you take, for example, let's take a recovery of a really catastrophic acute lower back injury. So of course there's the codes that for manipulation, for spinal injections, even for a surgical intervention for such a case. Now, what about rehab? What about patient education for that matter? That's something that needs to be changed in the system, because patient education is highly rewarding to the provider when it's followed by the patient. It's highly helpful and beneficial to the patient's outcomes, and structurally it should be rewarded within the healthcare system. And financially, the provider should be rewarded for that as well. So on the whole, these are the things we'd love to see change in healthcare. These are the ways in which you would see the triple win that would accomplish the quadruple aim in healthcare.
That's a great example. You know, I'm a chiropractor by field, and I've had multiple instances where patients have come in for a service, and for whatever reason, I was unable to provide X service that day. You know, maybe they presented with a medical condition that is outside of my scope, and I had to refer them elsewhere. But when that happens, I'm still spending, 20 to 30 minutes with them sometimes. And depending on your state and region where you practice, you might not be able to use a billable code at all.
A single code. You can't make a single cent off of that case.
That's a great example. And that can lead not only to physician burnout, but that also creates some cognitive dissonance with the provider. It creates a lot of confusion for the patient, especially if they do have to pay an out-of-pocket fee of sorts, or, maybe they're lucky enough that they won't have to pay anything and the provider just loses in that situation. But that also creates some confusion. I've had patients in those instances that are like, well, what do I pay you for today? And depending on their insurance, like let's say they have a Medicaid plan. Medicaid in Michigan is not going to pay me for anything other than spinal manipulation and maybe an x-ray code. So what do I do when a patient comes in and they have signs of a stroke, signs of a heart attack? that's a great example that I've actually never even thought about. But some of the things that are going to have to change as value-based healthcare continues to take over, we're going to have to change the underlying algorithm, which does involve insurance reimbursement. It does involve coding and a lot of the limitations that are dictating the way that providers practice. It's not fun to have autonomy, but then also not have autonomy. Like, there should be some kind of easier way to do this.
Yeah. And I think maybe to close off on a practical example, that there's going to be a positive and a negative side to this example that I give, but I think this is where some positive change can be made. It's in the case of auto injury, personal injury, and workman's compensation. So we know well, even from the literature, that when a patient gets embedded, particularly in a workman's compensation case, and there's yellow flags being raised, that case can become significantly chronic, and you have essentially an iatrogenic type injury that is essentially occurring with that patient, ultimately resulting in surgeries and unnecessary interventions and unnecessary imaging, all which is costing the system money, it's costing the patient time, and it's resulting in disability. So here's my challenge, which is to say, if you as a provider have a case that you feel has reached its terminal point, the patient has recovered adequately, they have turned a corner, they're doing a lot better, there needs to be a point at which that patient needs to be encouraged to leave the system and to go out and spread their wings and no longer be subject to almost the shackles of those workman's compensation cases. It's an interesting. I'm looking at it as an outsider. As you can hear, my accent is foreign, but it was very interesting coming into the United States and observing these type of cases where I saw patients with a motor vehicle injury or a workman's compensation case. They went through the course of care, they went through the litigation, everything was smooth flowing, but the patient recovered and they remained within the system, which created a cycle of disability and a fear avoidance mentality and all sorts of yellow flags for that poor patient. And I felt really sorry for them. I felt that they had so much more potential as a patient. And I looked at the provider and I thought, well, they're kind of beating their head against the wall with this because there's not much forward movement. So I really do feel that as a provider, you can perhaps draw a line in the sand and say, let's go. Let's move on. It's time to spread your wings.
Well, and we forget too as providers, because we're so immersed in healthcare, that it goes beyond healthcare also. So the case that you just, presented, it could be workman's comp, it could be MVA, it could be whatever. We forget that the actions that we are performing with that patient, the decisions we're making with them, the conversations we're having to them are also going to lead in other areas of their life. That disability, that car accident, that constant systemic need for healthcare services is going to affect their relationships. It's going to affect their ability to have children and take care of said children. It's going to affect their work life, whether that means becoming fully disabled or maybe they are able to work, but they forever will have these limitations in the workplace and that, negative connotation when it comes to the workforce. It can affect people's religious status. It can affect things like depression and anxiety, which we already know. So therefore, we're entering the world of mental health.
Their involvement in hobbies and
correct.
Sports.
Exactly. So it's so much more than just healthcare. And I think it's easy for us as providers to kind of stay in that bubble because we're always talking about healthcare. We're always talking about and with our patients. But we need to look at that individual and understand if they're able to be discharged or if they're able to even switch to a different form of healthcare because they've accomplished maximum medical improvement, you're not only helping them in the world of healthcare, you're helping every facet of their life. Yeah. It's really important. That's the whole point of value-based healthcare. You're treating the individual, not the diagnosis or not the MRI report.
And as a provider, you may lose out in the short term financially on that case. But in the long term, you're going to win the loyalty of that person for life. And who knows what spin-off benefits you're going to receive from that by way of referrals and just the reputation of your practice. So on the whole, provider satisfaction will increase. You're going to love your job. Patients are going to love you. And hopefully we'll see an improvement to the system as a whole.
I love it. So on that final note, it's a win-win-win. So let's make the switch. We are here to literally help educate everyone about value-based healthcare. And we hope that this episode is inspiring you to make some changes today on some of the systems you have in your practice. Thanks for joining, guys.
Thank you for tuning in to the Providers Report. We hope you found today's episode valuable and inspiring. To stay updated with our latest episodes, subscribe to our podcast wherever you like to listen. For more resources and continuing education opportunities, visit our website. Together, we can make a difference in the lives of our patients and truly set a standard for value-based healthcare.